The number of coronavirus cases in Arkansas has now surpassed 20,000. This is a look at where things stand after today's update from the governor. Another 439 cases confirmed from last night, with more than 5,900 cases considered active. Another Arkansan with COVID has died. It brings the death total now to 265. Of the active cases, 300 are hospitalized, and of those, 63 are on a ventilator. 14,000 patients, though, in the state have recovered. Northwest Arkansas remains the major hot spot in the state, with more than 30% of tests coming back positive over the past few weeks. And Benton County, meanwhile, has just over a 10% positivity rate. Governor Asa Hutchinson says his goal right now is for the state to have a 5% or less positivity rate.
In previous weeks, the governor attributed increased testing to what's leading to the growth of COVID-19 cases in Arkansas. While testing is up, it's not by much. Here at 5 News, we analyze data comparing testing versus case growth. 5 News reporter Juliana Clipson joins us live with a look at the numbers and feedback from state health officials. Juliana?
When comparing the data, it's clear that although testing has increased significantly since the start of the pandemic, that's not the sole factor leading to the increase of COVID-19 cases by the hundreds each day.
No one plans on getting COVID-19, but it happens, and it happens when you think it won't happen to you.
Each day, hundreds more Arkansans contract the virus. This graph uses data from the Arkansas Department of Health. You can see here in Washington County, last week, cases grew by 50%. Testing capacity grew by 14%. In Benton County last week, there was a 23% increase in cases, but just a 2% testing growth. In the River Valley, Sebastian County's testing capacity grew by 25%. Cases increased by 85%. And finally, overall in Arkansas, looking at last week's data, COVID-19 cases across the state grew by 37%. And as for testing capacity, there was only a 1% increase. Previously, Governor Hutchinson mentioned increased testing as a large factor for rising numbers. When asked today what's leading to the spread after hearing the percentages, this was his response.
Outside of increased testing, what factors do you believe are leading to the increase in cases across the state?
Well, I mean, of course, we've had an increase in cases, and I think that's a combination of factors.
The governor went on to say a limited number of outbreaks and some complacency in the community have led to the large increase in cases. Dr. Dillahay and Dr. Smith with the ADH say it's a combination of more testing, also paired with community spread.
Whenever people are breathing each other's air, there's the opportunity for transmission, and obviously more of that has been occurring.
We know in Northwest Arkansas that we are having outbreaks and spread that can be documented in work sites and in the communities.
Over the weekend, there were 12 COVID-19 related deaths here in our area, with 2 in Sebastian County, 4 in Washington County, and 6 in Benton County. Live in Johnson, covering news where you live, Juliana Clipson, 5 News.